I'm Glenn Wood.
And I'm Richard Tadamir.
We're psychotherapists based out of British Columbia, Canada, and you're listening to Deliberating Practice.
In this podcast, we deconstruct everything from the foundations of therapy to its newest innovations and horizons.
We take a critical perspective on contemporary issues that affect therapists across the world. We share our own stories, both personal and professional, and sometimes we talk to other therapists too.
We hope that this podcast can be like sitting with the trusted mentor you always wish you had, helping you integrate and make sense of our complex and exciting field.
So sit back, relax, and enjoy the episode. For resources, show notes, and to work with Richard or Glenn for supervision, consulting, or counseling, go to deliberatingpractice.com. All right. Good evening and welcome to the Deliberating Practice podcast. I am your host, Glenn Wood, joined as always by your other host, Richard Tadamir. And tonight we're joined by a special guest, Zach Walsh. So good evening, you guys. Good to see you both.
Evening.
Yeah. How are you both doing tonight?
Good evening.
Good. Zach, thanks for joining us. It's great to have you here. Yeah, tonight's episode is a special episode. We have another guest. We've got Zach Walsh. Zach, you're a professor from UBC. Am I right to understand that?
That's correct. Yeah. Professor of psychology at UBC, specializing in the clinical psychology track. So I mostly teach grad students. I do an undergrad course in drugs and behavior, and then I train psychologists in psychotherapy in their PhD, and then I also run the problematic substance use clinic, which provides services to the community and also to students, but it's not specifically for students.
Wonderful. Wow. So you do quite a bit. Well, we've got Zach here tonight too, because Zach, you're, I understand, a subject matter expert in the realm of psychedelic assisted psychotherapy, which is a topic Richard and I have explored in a previous episode. So tonight, we're very happy to have you to be able to expand that conversation around psychedelic assisted psychotherapy. It's kind of an exciting topic in contemporary psychotherapy. Do you want to say a little bit about, just preliminarily, about your work and your interest and relationship with psychedelic assisted psychotherapy, so we can kind of locate you in the space and get a sense of how you're rooted there?
So, since I'm from Winnipeg originally, and I did grad school down in the States and came back for my position at UBC. I've been working primarily in substance use and actually in corrections in the US. And then when I came up here, the cannabis, it was around 2009. It was just when the dispensaries were starting to expand, and part of my interest in when I had been doing some of my training in corrections was I was always very upset with the war on drugs and the incarceration epidemic. Prior to grad school, I'd worked in social justice. That was something, sort of social change, was something that I wanted to be able to do, and the way that I saw that was learning a little bit about the incarceration system from the inside. And when I came to Kelowna, I saw this tremendous opportunity with all the dispensaries just starting up. I think there was just one in Kelowna and maybe 3 in Vancouver at the time. So started working on cannabis and got really involved in that. Started learning a whole bunch about the therapeutic potential of cannabis. I'd started off as an anti-prohibitionist, but then I became really fascinated with the very legitimate therapeutic potential of cannabis medicine. So I got in that world, and that introduced me to MAPS Canada and MAPS US, where, I think then it comes to about 2015 when they were doing the MDMA clinical trials in Vancouver, or the phase 2. So the first round of MDMA clinical trials was PTSD, and they were looking for people to work on that study. And, I had, prior to grad school, I was a deadhead. Rest in peace, Bob Weir. But so I followed the dead and was very interested in psychedelic culture. So I felt very comfortable in that world. And when they were looking for people to work on the trial, I got involved there. And, one thing led to another. The psychedelic area started to grow rapidly. I've never stopped doing my work in cannabis as well, and started, complementing that with some work in psychedelics and getting involved in some different attempts at clinical trials. We tried a bunch of different things to get stuff off the ground at the BC Center on Substance Use, and learned a lot along the way. Now and kept moving with it. I've done some studies on microdosing, worked with Paul Stamets on the Microdose Me study, and finally, after years, I mean, you got to be so patient with this stuff. So after years, we're finally running the clinical trial of psilocybin for problematic opioid use. That I think we wouldn't be surprised if it's 10 years when we first started talking about it, and we finally ran our first participant 2 weeks ago, I think. So
Wow.
yeah, I remember once speaking with Rick Doblin because we were running the cannabis trial in parallel to MAPS, cannabis for PTSD. And I was so frustrated because it's going so slow. And he said, slow and steady is the best you can hope for in this work. So it's been slow and steady, but I've never stopped working in psychedelics and now able to do things that I think, if I could take a time machine back 10 years ago, I would certainly be impressed with how much the field has grown and the opportunities that are there.
Mhm.
I've been able to work with psilocybin in SAPs. I've worked on a couple of clinical trials, psilocybin assisted psychotherapy, worked on the MDMA trials, then also done an SAP with MDMA, currently leading the psilocybin for opioid titration trial, and also a lot of large cross-sectional stuff, just looking at, I think we learn a lot from what people are doing out in the real world. I don't privilege clinical trials as a way of knowing necessarily, but it seems the thing that people are wanting that kind of evidence. So part of it is just trying to speak in a language that resonates with the larger medical establishment that I think is decided somewhere along the line that was the only kind of evidence that was really going to move the
Mhm.
needle.
Can you say a little bit more about that? That just seems like a interesting point to flesh out a bit, like your experience of, I guess, gathering evidence in psychedelic assisted research and feeling like you need to structure your evidence in a very particular way, like in a way that's appealing to the medical community.
Yeah, and I've seen it in cannabis too. And when we did our first cannabis trial, one of the things you have to do is you go through a process. It's very much as if it's a new drug, but it's not a new drug, of course.
Right.
So you're something theatrical about pretending that it is. You have to find in the case of the cannabis trial, you have to write what they call an investigator brochure, which is just a ton of work. It's a fair bit of work if it's a new drug that you're bringing to market, but it's meant to encapsulate everything that's known about the drug at the time. So if it's a new drug, there's not that much known about it. There's the little research that you've done on animals and maybe a few human subjects, but you try to write that about cannabis, and it could fill 20 volumes. So
Right.
it's just twice as much work. Ultimately, with with a PTSD trial for cannabis, as much as people would joke and say they must be lined up around the block to get the free cannabis, the truth is anybody with PTSD who wanted to try cannabis was using it at the time and didn't need the rigmarole of a clinical trial. And those who were naive to cannabis were not interested in the trial. So and if you were using cannabis, then you weren't eligible for the trial because it would have been a trial where you're trying a different kind of cannabis. We weren't wondering if one type of cannabis is better than the other, and if cannabis is working for people, they don't want to quit it to get into the trial. So I think there's certain specific challenges that come with using these drugs that are well characterized and well known, and having to act
Mm.
like it's totally new. And in terms of people you can include in the study, it becomes very complicated. Less so with psychedelics, because there are many people who haven't explored psychedelics who maybe want to, or who have not wanted to do it outside of medical, but still most people know. And then if you're supposed to be blinding people and they already know what the psilocybin experience is like and all those questions, yeah, I think it's a good way. My hope is that some of this research goes beyond. I mean, it'd be great if we find some new treatments, but I also think it's an opportunity to question some of the paradigm around how do we come to know, and what do we know in mental health? How much do we need to know? And are the
Mm.
standards consistent across interventions? Because there's all kinds of psychiatric medicines that don't have half as much evidence for safety as psychedelics, and they're widely prescribed. Yet when you bring up psychedelics, you could say there's thousands of years of people using it. The harms are well characterized, very well characterized. There's been an effort in cannabis and psychedelics to find something terribly wrong with them. That's basically been all the research has been focused on harms for half a century.
Right.
So we know this. We know the safety profile is fairly good. At which point, and we know that there's a good signal that can be helpful for some people. Yet we have to act as if we're entirely naive and start from scratch and treat it as if it's some new discovery. So. Yeah, it's complex. It can be frustrating, but it's also very hopeful. So I don't want to sound like I'm frustrated with it, but it's just
Well, yeah, I mean, I imagine there is something interesting about pretending like you don't know anything about something that you know a lot about, like that it kind of creates this maybe a new openness or like conditions for new openness. So that's sort of interesting. But I think what you're saying, and this is how I'm thinking about it, I guess, is like there's like a frame that psychedelics are already maybe understood within that is, kind of like grassroots or, rooted in culture or in specific communities. Like there's a kind of colloquial frame. And that is actually kind of great. Like it provides a lot. And you're saying you kind of have to break from that frame in order to research psychedelics. You're actually kind of maybe losing something of what that frame offers in an effort to cater to the medical community and sort of get your research advanced.
It's true. The clinical trial apparatus really builds a huge moat around knowledge production. Because it costs millions of dollars, and you need a whole apparatus. And if the medical community says this is the only thing that we'll listen to, on the face of it, it seems like it's being cautious, and it is being cautious and being responsible. But at the same time, it's really limiting who can sit at the table and say, here's what's knowledge, here's what we know. Because you say what you know, and you can bring 1,000 patients who can say that they had great experiences, and then someone can say there's no clinical trials. How do you know it's not placebo? And then you say, well, how are you supposed to, how can you have a randomized controlled trial with placebo for something that is so psychoactive? And then you think, well, maybe you should use an active placebo.
You mentioned,
Yeah.
When you mentioned blinding, I just thought, how would you blind a psychedelic medication?
Sometimes they'll say use an active placebo, but you have to think about the context too. So in psychedelic therapy, people are sitting for maybe 6 to 8 hours with a sleep mask on and headphones, listening to music and go inwards. So that can be a really powerful experience with psychedelics. It can be a powerful experience without psychedelics, but it can also be a very annoying experience without psychedelics. And then if you take the advice of using active placebo, some people said, this is, I think, one of the benefits of people with lived experience doing the research. So most of the people that I work with, and in our group have their own experience with a variety of substances. But if you haven't, you say, oh, well, maybe we would give someone a stimulant so that they would at least feel that something is going on, so that they're not sure they're in a placebo condition. But I mean, if you give someone a stimulant and tell them to lie still with a sleep mask on for 8 hours, that's hardly an accurate blinding. That's a torture condition.
Yeah,
that's a good point.
Yeah, that wouldn't be really representative of a trip at all, or synonymous with it.
Yeah. Yeah, and it biased the findings because someone's like, I thought I was depressed before. Now,
I'm a part of my, I'm still thinking about one of the other things that you talked about, Zach. As you're introducing your work, which is like just the time frame and the length of, we're kind of talking about, I guess, the advancement of this research, right, and what goes into that, and part of what you spoke to, which is the time frame, which resonated with me. And Richard, I don't know if it resonated with you too, but I remember encountering the beginnings of the growing interest in psychedelic assisted psychotherapy back in my undergrad, which would have been in, I guess, 2010, 2000, I think 2009 to 2013, that kind of era. And then kind of again in grad school a few years ago now, really seeing it kind of pick up and there's like I guess like a loose community of practitioners and sort of like a non-sanctioned implementation of this. And so I think when Richard and I, as we've been engaging with psychedelic assisted psychotherapy content too, and part of our discussion around, what we would talk about with you, we were sort of like, what's going on? Like, where's the, like, we've also been thinking about this for 10 or 15 years. So like, what's the holdup? Like, is this not a thing yet? Like, It is interesting. So when you said, okay, you're doing like the research is happening now, that's pretty incredible. But it's interesting to me that it's taken as long as it has, like given the interest, given what you're saying about the safety and kind of the established understanding of what the drugs can do. Yeah, Richard, I don't know if you share my thinking in that direction.
Yes, I definitely do, logically. Yeah, with the amount of evidence that's there. I think we have very good evidence on the safety of it. It's been so well researched because I think the cultural beliefs for many years in kind of Western, say American Eurocentric culture has been, well, these things are going to be so harmful. So we've studied it so hard, yet there's still, it's kind of a fight against the kind of dominant cultural belief. I think there's changes, but it's a kind of a battle for hearts and minds, maybe.
Like I'll ask you both this question because you're both pretty involved in the space. Do you think the culture is the primary reason that things are going as slow as they are? Do you think it is that's sort of what the main barrier to this being more readily accepted as a viable treatment? Zach, guess first.
Yeah, no, but having looked at cannabis as well, I was surprised how much less resistance there is to psychedelics versus cannabis. People, I think, are more open to psychedelics, especially if you start talking about psilocybin rather than mushrooms. I had a researcher I work with people would say, "What are you working on?" He'd say, "I'm working on 5-HT2A agonists." And Bill, ooh, that's fascinating. But if you're working on LSD, what are you doing? I think that there's just so much stigma around cannabis and so much cultural baggage there, but with psychedelics too. And I think perhaps there's not the kind of profit potential that we're used to with new drugs. So there's some money behind it, but it's been slow. So, the Compass trials for psilocybin, I think that's going to be the first one. That's going to be a couple of years probably. And then there'll be a drug, a drug probably for depression that's about psilocybin, and then people will, I think, look at off-label. But I hate giving numbers now because I've been saying 2 to 5 years for the last 15 years.
Yeah, and I wonder too, and I'm sure we can delve into this more later too, but just to bring up, like, how much of it is a threat to, the status quo, a threat to maybe capitalism, a threat to individualism, right? So I do wonder about that, right? I remember reading Brave New World a number of years ago from Aldous Huxley. And of course, he was a great proponent of psychedelics and talking about giving psychedelic to, leaderships of country and everything like this. Yeah, because, often I have a colleague and she was involved in some of the early work as well, I guess, in terms of the special administration program or special access program, and some of the first in 2019 with end of life distress. But since then too, she's had other people that have come. Maybe they've been in the tech space and they've been in, high kind of wealth, income, and she warns them like this is a lot, right? You're saying you want to do this because you want to become more productive or more efficient or get some brand new idea, for a company, but this may rock everything that you know about yourself and the world and relationships. I guess the potential may be for destabilization, but and revolution. I do wonder about those things, right, to the existing order. Zach, do you have any thoughts on that?
That was what Timothy Leary's warning. He said, they're quite safe, but be open to the possibility that you might be changed afterwards, and you have to be prepared for that. I'd like to think, listen to some things that Terence McKenna say about the potential for psychedelics to catalyze the kind of, I hope that they're a threat to that stuff, but
well, yeah,
they
me
are.
too.
The potential to catalyze broader social change and awaken people to core values. And on a good day, I do believe that, and I think that's part of what makes me dedicated to it. But more and more, I think they're powerful tools, and I think they can be used in a variety of ways. So certainly we see some people that are avatars of the kind of hyper greed, hyper capitalism world that are also proponents of psychedelics, and that's kind of been twisting my brain lately. So how did psychedelics become coded in that way, or at least partially? It's curious, but certainly we all know people who've taken psychedelics and have not become more enlightened. They've just become convinced of their own perfection. So I think there's that. I think that if there is a risk it can foster a kind of sense of specialness or narcissism if that's in you. Yeah, I think it's like a telescope. You look through it, or a mirror. You can learn a lot from looking in the mirror, but it can also become too self-reflective maybe, and not enough reflective outside. I think if it catalyzes change in society, change in your relationships, that's great. But if it becomes an endless cycle of so-called self-improvement, then you end up just with more self, and you probably had enough to start with.
Right. I'm just thinking of the distinction between getting high and having a meaningful experience, and they're not the same. Like what you're talking about is more like just getting high. Like it's about kind of the drug as a pleasurable experience or an enhancing experience. I would imagine the meaningful experiences that come with psychedelics, they're not always pleasant, but they hold a
No.
value that is transcendent of like goes beyond pleasure, I guess. Goes beyond enjoyment in the experience. But not everyone has that kind of experience, I
I,
suppose. I suppose there's a lot that
I
goes
mean, for some
into,
people,
yeah.
it can. Oh, sorry. I mean, for some people, it can be just fun. But I
Yeah.
think what I'm talking about too is even the idea of self-improvement as the be all and end all
Yeah.
of existence. When I think of the tech bros and biohacking, and then even people I see sometimes, I think people should be allowed to use psychedelics as they like, but sometimes you'll see people that are so focused on moving one step closer to enlightenment that they are become completely self-obsessed, and they're
Yeah.
always
hmm Yeah, like maybe we would say there's like an obsessionality that psychedelics can be roped up into, and they become fuel for this engine of obsessionality as opposed to something that breaks that.
Yeah, beyond getting into shape, now you're just obsessed with getting ripped and being at the gym, but it's like the
Yeah,
psycho-spiritual
yeah,
version of that.
yeah.
But I mean, not to be negative, I think for most people it's a really
No.
powerful and
Well, yeah, I mean,
wonderful, wonderful.
yeah.
Obviously, it's been my life's work, but
Yeah, but I mean, it like this is saying something about the nuance of it, I guess, and that it's not so straightforward. And I'm sure that a lot of like consumers and people within the scientific community would probably like it to be like that. You just take X drug and get Y effect, and it sounds like that's not what's happening here. Like it's actually quite a bit more complicated than that.
And so much is dependent, right, on that preparation, the person who is working, the sitter or the therapist or the indigenous healer, whoever is working with that person, and the timing in their life. Like we've done other episodes talking about common fact, like the number of factors that's going on that influences the experience, right? Their readiness, the intentions. So the preparation and the set and setting. And that's something that is so different than doing a clinical trial for, Tylenol back in the day. It's very straightforward. And I do wonder, and Glenn, and I did an episode a few episodes ago around Jonathan Shedler, the psychoanalyst, about the problem with clinical trials in understanding really the mechanisms of change in psychotherapy. And in many ways, they seem inadequate. So there's a lot of concerns there. So I share some of your concerns, Zach, about this.
We'll shift a little bit. I have like a big question for tonight. This would be like the big question for me, at least. And maybe Richard's got some of his own. But for me, the biggest thing that I want to engage you around is really just the question of why, Pat? Like why psychedelic assisted psychotherapy? And it's interesting. You're a clinical psychologist as well. You teach psychotherapy. I'm assuming in like a conventional frame as well. And so to me, it feels really interesting to ask you, like, why not just conventional therapy? Like, what's the need for psychedelics? What's the attraction psychedelics? Like, why add them into the mix?
I not for everybody, but I think one of the things that I don't think there's anything that you can do with psychedelics that you couldn't do in a perfect world with conventional therapies. So if someone was already committed to therapy and already open to doing the work and already and willing to 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 stick with it over 3 months, 6 months, 8 months to really get to the bottom of things and show up every week and be focused. But we know that for many people that's really difficult, and even having so many people have tried a little bit of therapy and not got the results perhaps they want. So can be a skepticism. So one of the things that I like about psychedelic therapy is that it binds me in a meaningful way, that we're going on an adventure together. It's one thing if you want to come over to my house, once a week for 6 months, or we can do a 2-week trip to Mars. And once we're on the trip to Mars, no one's coming back. Like we're gonna be working together. We're on this adventure together. And I can tell you, okay, we're gonna meet, and maybe not 2 weeks, but it can be 6 weeks. And most of my work is in problematic substance use. So, for example, someone has a lifetime of problematic substance use, and you move towards their quit date, let's say, if that is their goal, is their abstinence or their date of change. And there's all kinds of great behavioral things they can do and stuff, but it takes a lot to be able to stick with it, and nothing big is going to happen right away. So doing the work and staying with it sure be nice if we had a little something that was going to make it exciting. So if I'm working with someone who wants to, and I'm not getting there's all the wonderful mechanisms of psychedelics too, but I'm just talking about what it does for the relationship. If I can tell you, okay, we're going to meet, I'm going to get to know you a little bit. We'll spend a couple sessions establishing rapport and conceptualizing the problem. And then, okay, now in 2 weeks, we're going to have this really big transcendent event. We're going to meet once a week as we prepare for that. And then after, and that your quit date is going to be, a week before the psychedelic session. And then I'll meet you the day before, and I'll meet you the day after, and then I'll meet you another week after, and then a week after that, and then we do another one. And all this time, there's all this change and possibility and excitement and engagement that's happening. That's different than if I say, next week I'm going to teach you a new mindfulness exercise, and we'll talk about going to the gym. No, this is something big, life-changing that's happening. And so, and by the end of it, after, if I think about the typical course that involves maybe 2 sessions, by the end of it, we've been working together for 6 weeks, and we've had ups and downs, and wild things have happened, things that have never happened to you before, and we've talked about them. And wow, look at that. You've been 6 weeks abstinent. Who knew? And it's like, wow, this thing happened. This nice course with a start and an end and an arc, and you've been vulnerable, and I've accompanied you on a journey. So that's not all there is to it. I think there is real change that comes from the psychedelic itself, but there's no way to engage that journey without the promise of something miraculous. And what does it cultivate? It cultivates curiosity. I often think, people think that not you guys, of course, but sometimes people conceptualize the opposite of depression being happiness. But I think the opposite of depression is curiosity. So we're cultivating curiosity. I'm demonstrating to you that I'm in your corner. I'm going to sit with you through this potential hellscape. Maybe it's going to be part hellscape, part nirvana, what have you, but I'm going to be right there. If you raise your hand up, I'm going to come and give you a reassuring touch. And I just think it cultivates a really great relationship on top of whatever chemical experience is happening in the.
That's an interesting answer, Zach. Thanks. I'm just thinking about all that you're saying now. I mean, the first thing that's striking me about what you're saying is you're kind of saying that maybe one of the advantages to psychedelic assisted psychotherapy is that it kind of creates a different and maybe more readily accessible frame for psychotherapy because of its time limited nature and because of how you kind of describe the arc of the adventure. And that's really interesting to me because fair enough, like it is very difficult to engage in psychotherapy, where there's a great deal that's indeterminate. Like, you're going to go and see your therapist for some time. You don't know how long until you're better, essentially. And that can be quite opaque sometimes. And so you're saying there's something a little bit comforting, or there's a little bit helpful in the idea of like an accessible a frame that describes, like kind of like a time limited experience where, you'll get something out of it. So that's interesting. But I guess the other, like the thought that's burning in my mind is I think you're kind of just saying in some ways, and correct me if I'm wrong, okay, but I think part of what you're saying in some ways is that what's exciting about psychedelic assisted psychotherapy is that it's convenient. It's convenient in the sense of what we're kind of talking about, like its accessibility, this accessible frame, but also convenient. And it takes less time. It works a little bit quicker. And I'm really sitting with that because I wonder about that. Like, I guess I'm thinking about, it's like other types of therapy can often be less convenient, but I think that sometimes it's the inconvenience of that therapy, or it's the work that comes in that therapy that is the value. And so I'm just wondering what you think about that, again, as a practitioner of conventional therapies as well. Is convenience the most important thing in therapy? That's like maybe my
don't know
burning
if
question.
convenient it would be the word that I'd use, because it's just such a hassle right now. Like, it could be convenient right now. Well, I know what you're saying. So is there a reason? So I guess what you're saying is there a reason to set an expectation that we can do this quicker and better and more effectively and clear out some of the mess? And I understand the resistance to that. It's like, someone says, I can get chicken soup at the store, and why would you make your own chicken soup? And you're like, no, I want to make my own soup. It takes
Right.
time, and there's part of, so why I don't want to be lazy and just get the prepackaged enlightenment. And that's certainly, a critique, is that there is no easy path. And so to present it as an easy path is contrary to the very essence of what we're trying to do as we try to cultivate patience and forbearance and all those values. So I hear that. But at the same time, if you were to translate that to a different type of medical intervention and say, we have a rehab approach that's going to it's going to double the speed of your recovery for your limb. And you say, but what about all that exercise and that time at the gym and the benefits that you get? And I'd be like, no, you know what? Give me the bionic arm. So I think when people are really suffering, I don't want to be too, there's no shortage of struggle in the lives of many of the folks that we work with. So if I can make something easier, as much as I don't believe in easy answers, I believe that something's too good to be true. It is too good to be true. But I sit with a dialectic, I suppose, that I hear what you're saying, and we don't want to get their quick fixes, but sometimes there are quick fixes. And isn't that beautiful?
I mean, I hear what you're saying too. And I mean, I think, yeah, you're fair to say that we don't actually want to misconstrue psychedelic assisted psychotherapy as an easy path, because you actually have to endure something very dramatic. Like I've experienced psychedelic experiences before. They're far from easy. So, I mean, fair enough that, it's, in that sense, we don't necessarily understand it as the easy path. But yeah, I mean, I suppose I share that's where my heart goes in this too, right? Is the idea of like a convenience culture and what that does at kind of a meta level, that, that in accessing this therapy, people would be actually robbed of a certain kind of experience, which holds a different kind of value for them. The experience of working through something, for lack of a better word, organically, I suppose. And that could be taken away. That could be, that would be absent from the experience of psychedelic assisted psychotherapy. And I mean, that's kind of what we were talking about at the beginning a little bit, around how we understand therapy, how we understand effectiveness, how we look at and evaluate the effectiveness of therapy. I mean, we don't always capture those kinds of variables, which I think can be really important. The nuanced experience of the patient. Sometimes it is the grind of therapy that actually, is what is meaningful, is what is valuable. So, yeah.
One of the things that sometimes disturbs me when we're talking about psychedelic therapy is that people do complain, how are we going to fit this in the healthcare system, because it is so arduous. 8 hours of therapist time, it's expensive, it takes space. And, many of us have equity front of mind, and we're thinking, yes, how can we make it more accessible? And absolutely, we want to make it more accessible, but I wish we'd stop talking about how expensive it is, because we don't talk about how expensive hip replacements are. We don't talk about how expensive all kinds of other interventions are. But with psychedelic therapy, everyone's like, it's so expensive. It's the kind of expensive that I think we want. We want hours of therapist time devoted to creating relationships rather than being spent on technology. There seems to be anybody's willing to open their pocket, the health system, for some new like MRI-driven intervention that feeds into your smartphone and can replace human engagement. I think perhaps it's a way to rehumanize and get us away from that convenience culture. And the other thing that comes to mind when you're saying that is so many people following, and perhaps this is your experience, because we're all sitting here when we could be in front of the TV, but we're doing our work, and maybe because we're curious about psychics. And I think that perhaps many people who are paralyzed by depression, PTSD, following a psychedelic experience, are able to re-engage in some of that really hard work of living that they've been staying away from, and that is perpetuating their ill-being. I don't think if you do psychedelics right, it doesn't make your life really easier. It might make it more rewarding, but you might find out a whole work, you might figure out that you got a lot more work to do than you thought, and it's not only about symptom reduction.
This, that's funny you say that, Zach, because that's pretty much what Richard said in our psychedelic assisted psychotherapy episode when I engaged him around a similar vein of questioning. Was it's not quite like that. It's often the opposite. Like if you said, Richard, if anything, psychedelics have just made me more interested in regular therapy. Like it's just opened up your mind to more of what that could bring. So it's funny that you say that, and that's fair. That makes sense. Yeah.
And especially for people that are difficult to engage in regular therapy. So, I've spent a lot of time working with men. Some men struggle with violence, substance use, and who may not be the most psychologically minded or even really in touch, not even knowing about their emotional life and their psyche is something that's valid and warrants exploration. And sometimes that, and the idea of sitting down and getting there, I mean, we've probably all been in that situation with clients where it's hard to know even where to start when it comes to really some of that heartfelt work. And sitting with the psychotherapist on a psilocybin journey and weeping for an hour over your childhood can be a good start for like, hey, remember that place where you were that you didn't know existed and that you thought you was done when you turned 9? No, that guy's still there and he's got some grieving to do. So I think for those of us who are engaged in the work because of our work, it's one thing. We're thinking about psychotherapy all the time, but for some people it can open up a whole world that just they'd heard the words before but had never really experienced the kind of heartfelt insight, openness. It stops sounding like new age psychobabble that they have nothing to do with and starts to be something they can locate inside their selves, maybe.
I love that felt sense of healing.
Yeah, I know. I mean, I appreciate your answer a lot, Zach. And where my mind's going now is I'm just thinking again about what I really love about this particular context in psychotherapy is that it represents this. I think it holds the potential for this kind of paradigm shift, because isn't it so funny that when we talk about like what we can expect from psychedelic assisted psychotherapy or its clinical rationale, that we kind of can't talk about it in the most basic way. Like obviously we, in some ways we can say, oh yeah, it reduces depressive symptomology and things like that. But like it almost invariably demands that we go beyond that to really understand what it's all about. And that's, to me, that's kind of a beautiful thing, because I feel there's been this tremendous disservice done to the world of psychotherapy by coupling it so closely with the medical community and disorders and the DSM and things like that. So, I mean, and here we are again. We're talking, oh yeah, like the result is like it's not necessarily just, or not even necessarily a symptom reduction, but maybe it's just an increased openness to the kinds of experiences that would support, personal healing or, inner transformation, which is a different kind of outcome than the medical community might hope for therapists that are invested in this, like maybe a humanistic understanding of psychotherapy. Wouldn't that just be it right there? Like, wouldn't that just be like the best that we could hope for in terms of outcome? Yeah. Well, so I mean, thank you for engaging with my big question.
Yeah, I don't think we're going to put ourselves out of business with psychedelic assisted psychotherapy. I think we're safe.
Yeah. I had that anxiety.
You did.
When I was young. Yeah, when I was a new therapist, I was like, "Oh no, did I pick the wrong career?" We're right on the eve of this.
Was not worried at all about that.
Yeah. Am I going to be out of a job? It
Just have to
seems that
learn to
won't be the
DJ.
case.
Start a band.
Yeah, I
Wouldn't be
suppose
the
there's
worst
worse things, isn't there?
Yeah.
Richard, I want to open the floor for you to ask Zach a
sure.
big question now. Yeah.
Yeah, the big question kind of that I have is, my starting this podcast, the idea was looking at the possible futures of psychotherapy. So, in particular, would love to hear from what your gut says and what your heart says about where do you think psychedelic assisted therapy is going? So maybe there's an element of like, what are the next steps and where is it going? But also I want to hear from you where you hope it would go. So either way, answer that however you would like, Zach.
Well, I'm an optimist, so I'm gonna answer the same both ways. And what I hope is not, one of the things that I resist a little bit within the psychedelic world is almost a messianic feel, like this is gonna change everything, and the world will never be the same. I think there's plenty of problems. There's so much mental distress and we have limited tools, and The limits of our tools are evident in the fact that relatively poor tools are so widely used. So, I mean, if we had good drugs and good interventions and enough of them, and if they were available, because I do think there's all kinds of good therapies, but if we were in a good spot, we wouldn't need SSRIs, or they'd be only in special occasions as opposed to being scattered across the world and so over prescribed. So there really is a sense, I think, in mental health that we're kind of flailing and trying anything. I think if we have one more good new tool, I think that's a beautiful thing. So I think, the modest hope is that there's a new it's been a while since there's been a good new intervention in psychotherapy, So I think perhaps this is something that's new and gives us another way to help people. And maybe we are able to help 10% of the folks that are not getting as much help now. If there's a new treatment that's somewhat effective for some people with PTSD, and what that means is that it's very effective for some, a little effective for many, and then ineffective for some, that's fine. That would be great. A new intervention for PTSD, for depression, for substance use that maybe helps 10%. That would be great. I'm all for that. That would be well worth the investment. And I think that is a modest hope. More broadly, it excites me, and this is, part of what excited me about cannabis is I really like the idea that communities can have some autonomy when it comes to producing medicines that are effective for them. So the idea, my dream for cannabis was always that there would be mental health facilities where people could be engaged in growing their own cannabis. And because I've seen, particularly in the early days, how empowering it was for people to be able to grow their own medicine and share it with friends and have them, friends who have similar problems, have them benefit from it. And so the idea that some community would be able to, it's quite easy to produce mushrooms, more than enough for everyone. Unlike cannabis, I don't think that there's a whole lot of consumption going on. You gotta, if you find yourself in possession of a quarter pound of mushrooms, you'll probably have almost a quarter pound of mushrooms 6 months from now. So I think there's a autonomy of people to be able to produce their own medicines within a variety of communities, a variety of contexts, is really powerful, and that excites me. So the idea that it might be a window into doing mental health care differently is, I guess, my big hope. And the little hope is that maybe 10% better care, or something that can be tried with little harms. When we think about some of the harms that come from some of the other interventions, whether they're benzodiazepines or SSRIs, those all have nasty side effects and can be hard to get off. So it's not like we got this covered when it comes to mental health. And so there's lots of room to make things better, and we don't have to reinvent the wheel to be doing something that's worthwhile.
I love that, because 10% means thousands of people that may be connected to their family again, not carrying on intergenerational trauma, perhaps, maybe living a more meaningful life, contributing to their community. Yeah, again, even modestly, that's, if we really look at down to the individual and the community, it would be a beautiful thing. Well worth it for sure.
Yeah, I appreciate your answer too. It's modest, which I think is healthy, because I think that there's a hype train behind psychedelic assisted psychotherapy, which probably is too large. Yeah. So
we don't have many rules in my lab, but one of them is that you're not allowed to say paradigm shift. You're allowed to say paradigm. Throughout grad school, you get to say paradigm shift 3 times. So be careful with what you call a paradigm shift.
Love that.
You get 3 paradigm shifts. That's it.
Well, but it is sobering to hear you say it, because when Richard and I were talking about it, we characterized it like nuclear energy. Like, this is how we were talking about it. Like, it has that kind of potential, and also that kind of destructive potential, right? Like, but the way that you're talking about it now feels much more down to earth, I suppose. That it will make a positive contribution, undoubtedly, but that it doesn't represent such a massive change to the landscape that therapy will become unrecognizable to what it once was.
The problems that we're dealing with therapists, I think that the problems that we're dealing with as therapists and the medicines are both thousands of years old. So good things happen slow, and I'd love to be wrong. Hopefully we're all in some kind of Eden of psychedelic enlightenment. And like I say, the 3 of us just start a band, and we're just playing lutes down by the ocean, because there's nothing left for us therapists to do. And capitalism has vanished because of the insights of psychedelics. So the people that are devoted to cooking food are able to do so, and it's shared equally. And so nobody has to work. And I love that. That's good. I hope that psychedelics do that. But if they
Mhm.
don't, I'll be satisfied with a couple a new
Right.
intervention for PTSD and substance use.
I also want to emphasize that piece that you mentioned about, and we haven't discussed that in a previous episode so much, but I'm a strong proponent of that as well, of people being able to grow their own medicine. And I just came back from 6 days in northern Saskatchewan working with an Indigenous band there. And I spent a lot of time ice fishing, eating moose meat. You know, if we're catching a fish, the whole community is involved. Somebody's helping drill the hole. Somebody is teaching you. Somebody is making sure, you know, that the tent is staying warm, the hot chocolate's there so you don't freeze. And so that one fish represents a whole community. And I think when just being connected more to the land, and I know when clients are talking about, okay, well, you know, what would it be like to have mushrooms, or how do I know, you know, what good quality is? And I'm looking for particular companies that really, like, they literally sing to the mushrooms. Like they spend time really developing like a relationship. And I wonder about clients being able to do that healing process, that nurturing process. We're focused so much on this symptom reduction. Okay, well, depression scores are down, but it feels like it's a very kind of paltry, kind of poor look at what the potential for healing could be. It's taking this plant and treating it like Tylenol and taking it out of its whole ecosystem, right? There was all these rituals that were included with it. It was a step-by-step process. The shaman or the healer is saying, okay, I think maybe you're ready now, but we still need to work on this piece. There's somebody holding your hand, you know, there's a whole community piece around it. Again, clinical trials, given that they're so reductionistic, don't capture that. So I really love even just that piece of giving the freedom to a client, just as it was with, or it's been with cannabis, to be able to grow your own plant and grow it in a way that's that you learn about everything.
Thanks for that. I couldn't agree more. One more, or we could call it here.
One more. We have one more question. Yeah, let's do one more question.
Sure. Let's do one
Richard, the
more.
one I'm thinking about, I'll just ask it.
Do it.
Yeah, and that is when Pat arrives, like when psychedelic assisted psychotherapy arrives, what do you think it will look like?
I mean, I think, concrete answer, there's a couple steps for it to arrive. So I guess at a system level, who's going to pay for it, I think, is going to determine on some level. Is it going to be private, or is it going to be covered? And I imagine, I hear some talks that perhaps veterans will be like cannabis. Maybe there'll be coverage for veterans first. Maybe there'll be, sort of private supplemental health care will cover it depending on your plan. And maybe it'll be offered in some hospitals, and it'll probably vary from. So, and in a way it has arrived now because there's a special access program. So I think arrived is a bit of a moving target. But I think, I feel like it seems that there's a convergence around what a unit of PAT looks like. I think ideally it's 2 sessions with, and just the minimal package as it seems to organically be developing. If you talk to different practitioners across the board, people seem to be doing the same thing, which is 2 or 3 prep sessions, maybe 5, depending on the complexity, and then a psychedelic session, and then a next day check-in, and then a 3-day integration, 3 days post-integration, 3 to 5 days post-integration, and then maybe another couple sessions of integration, and then preparation for another journey, and then a psychedelic session, and then maybe another 3 integrations after that. So where does that leave us? At like 6 to 12 non-psychedelic sessions with 2 trips, 2 psychedelic medicine sessions, and maybe that whole process is 3 weeks, 4 weeks, 5 weeks. Yeah. So I think that's what it will look like. And just to answer your question in a really practical way, who's going to be able to access that? Are there going to be variations on it? If you've done it once, do you still need to go through all the prep? Will people be able to drop back in for a booster? What's the potential for groups? Are we doing groups because that's better? Are we doing groups because it's more affordable? Are we doing groups for the prep and the integration, but not? So I think there's certainly a number of fine points to be explored, but I think it seems to be converging around 2 medicine sessions with that are bracketed by preparation and integration of a couple sessions each at least. So that's what I think it'll look like. I hope they don't find some way to who I don't know who they is, but I hope the system doesn't find a
Yeah.
way to reduce it to the point of absurdity. Log on to Zoom and answer a questionnaire, and then we'll send you the psychedelics in the mail and sign something saying you're not going to leave the house, and then talk to an AI afterwards. So I hope it doesn't go there. I hope we keep it. Because as
Yeah.
I was saying earlier, I think that journey and that relationship that it can engender is so much a part of the healing.
Yeah. It's not really separable. But I guess the corollary question to that question then is, how do you think the system would absorb it, or how, like, because it's like you're talking about the ideal structure of PAT, which to me makes all the sense in the world. But then there's that second question of, will the system absorb it well? What would that look like systemically? Will there be clinics, like specialized clinics, or private practitioners, or
Probably.
like that's
You could imagine a space in a hospital, but also private clinics, I imagine, because I think it's not for everyone to do the work. So I think that, there'll probably be some specialization. I could almost imagine like a dental practice type of model where you have someone, a bunch of sitters in different rooms, and maybe a few people that are floating around making sure everything's going okay, and then perhaps parts of the preparation could be done elsewhere, and you go into a special location for the actual medicine. Yeah, I think there's room for and I think different cultural contexts are going to require different approaches. So I think there's room for flexibility, and again, the safety is there. I think we can explore and be creative with it, and eventually I hope that it's not something that they're just simply decriminalized, and then we can allow the creativity of our communities to find different ways to use these things. And I think people should be able to go to a venue and take psychedelics and dance around and have fun. I don't know if I'm going out on a limb with that one, but that's been some of the better times of my life, and I don't think they're
Mhm.
trivial. They've helped me, immeasurably. As much as some of the insights that I've had on, in deep sessions, I've also had some just really life-affirming,
Yeah.
wonderful times with friends, and I don't want to devalue that because it's not,
No, I love
um,
that.
doesn't have to be bitter every time.
It can be fun. Yeah.
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 Fun and healing can work together, right?
That's a happy thought to end on, Zach. So
All right.
maybe we'll wrap up there for now. Thank you so much for joining
Terrific.
us tonight, though. This was
Yeah.
really wonderful. And I think like wonderful, and I want more. We'll have to have you back to keep extending this discussion, because I feel there's more to talk about, and you've given me a lot to think about. So thank you.
Thank you so
Well,
much.
thank you. It's been really fun, and I'd be happy to come back any old time. So, yeah.
Great.
We'll
Great.
hold you to that because we're
Yeah.
excited.
Awesome.
Awesome.
Thank you.
Okay.
We hope you enjoyed the podcast and are a little wiser for it.
Thanks for listening.